Good morning, everybody. I think we're about ready to get started. First panel of the day, so exciting. So good morning, everyone. I'm Victoria Wrigley. I'm the Director of Operations for the Lehigh Valley Justice Institute, and it is my absolute pleasure to welcome you to the very first panel of our festivities today. This first panel focuses on mental health in our schools, particularly how trauma-informed approaches to education are working to diminish the school-to-prison pipeline. Mental health is a significant contributing factor to youth behavioral issues. Children with mental health disorders have higher rates of truancy, they're more likely to be suspended or expelled, and they're more likely to drop out of school. Traumatic experiences are even more likely to result in behavioral concerns like increased aggression, difficulty forming relationships, and substance use. When these problems are met with law enforcement instead of appropriate support services, children can be pushed out of school and into the justice system, where they're much more likely to experience unemployment, substance abuse, and arrest as an adult. This is the school-to-prison pipeline, and it's why support services are vital to the health and well-being of our children. So assembled with me today are some subject matter experts on this issue. First, over there is Dr. Harrison Bailey, Superintendent of Wilson Area School District. Andrew D'Angelo, the Executive Director for the Center for Humanistic Change. Nicholas Semutalis, the Administrator of Student Supports and Wellness for the Bethlehem Area School District. And Ezra Homanoff, the School Psychologist for New Haven Public Schools in Connecticut. So thank you all so much for being here for our conversation today. To begin, I'm just going to ask each panelist to spend a few minutes introducing themselves and their background regarding this topic.
Hello. Okay. So as stated, my name is Harrison Bailey, and I am currently the superintendent in the Wilson Area School District. I've been on the job about a month. So I'm going to be speaking mostly from my experiences as a building principal at Liberty High School. I went to Lafayette College, then Lehigh, started to teach in the Bethlehem School District in special education, and then spent about a decade at Parkland High School as an assistant principal, and then on to Liberty as the principal. And so over the 12 and a half years that I was principal at Liberty, we had the occasion to deal with a lot of trauma and a lot of needs. And so my entrance into the world of mental health really heated up as I started to recognize what was happening with our students and the lack of supports that existed in our communities. And so during this panel, I'll be speaking from that framework.
I'm Andrew D'Angelo. I am the current executive director of the Center for Humanistic Change. I just began there in July after over 25 years in K-12 education. I was a teacher. I taught everything from grades K to 12 and was also both a high school and an elementary school principal. I was the principal of Notre Dame High School right down the road. And I am now trying to take my second break from education, the day-to-day work of it. So like Dr. Bailey, I will speak from my lifelong experience in education, but also as someone who grew up with a mother who I am a native of Queens, New York, and my mom worked for over 20 years on Rikers Island in Austin H. McCormick, which was one of the groundbreaking alternative high schools on Rikers Island. And she also then worked at Five Towns Prison on Long Island. And she was for many years the president of the New York State Association of Incarcerated Education Programs, which focused very much on this kind of work. So I grew up with hearing her live it and talk about it and experience it on a very intimate level, because it truly was her life's passion. And she did just pass recently, so I feel like today is a little bit of a tribute for me to speak about her life's work. So I'm very happy to be here. Thank you.
Good morning. My name is Nicholas Semutalis. As stated previously, I'm the Administrator of Student Supports and Wellness in the Bethlehem Area School District. My journey in this work really started. I'm a proud first-generation immigrant. Came here from Greece as a young boy. English was not my first language and being a free and reduced lunch kid as my parents chased the American dream when they were raised as children and young adults and adults in some of the most horrific times that you read in history books over in Europe. And when you get into this work, you start connecting and putting dots about your childhood, and you start understanding some things which at the time we just didn't know. Similar to what Harrison mentioned earlier, we started this journey in 2017 when we started embarking upon understanding what does it mean to be trauma informed. And as we uncovered that journey, 2 years into that, it was the summer of 2019, and my son was getting ready to be a freshman in college, and I had this overwhelming presence, is the best way to say it, providence, if you will. And in that moment, it was clear to me that you're going to go back to school. You've been in education leadership all this time, and you're going to go back to school, and you are going to learn deeply, as I fell in love with this work, how to interface with the mental health community. So going back to school and clinical counseling, I said, okay, there's some non-negotiables, as if I can do that with God. And in those non-negotiables were, I can't pay for it because my kids start in school. And I'd be remiss to say in this journey, in my current role, if it wasn't the empowerment of Dr. Bailey, along with our former superintendent, Dr. Roy, who were forward thinking and saying, you know, we need to consider that as our administrators are in the whirlwind and they're managing people, kids, and systems, they don't have much in their bandwidth to be able to help in this manner. And so in that journey, I was able to have that opportunity where we've never had someone go through the clinical counseling program at Raven University. And it worked out through Dr. Roy in his office. It worked out with Harrison being gracious and educate yourself, know about it. And so now in this work, you'll hear later on about systems that were created, a lot of it by Dr. Bailey, but then also what did I take from that the district invested in me in order to interface and be able to merge both worlds together in this trauma-informed journey. So thank you.
Thank you.
Hi, my name is Ezra Hamanoff. I am a school psychologist currently working in Connecticut. I work in a particular school within the New Haven public school system. There's about 30 or so school psychologists total working in the New Haven public schools district at a time. Typically, we're actually facing a relative shortage right now because one of the things that nationwide we're facing is a shortage of school psychologists because the work has just become so difficult and so the expectations are so high for us and for our students. And in the New Haven Public Schools District in particular, we have a very diverse population. At my school, we have about 80% Latino students, and most of the school system, we actually have in my school a bilingual classroom set up where there's one classroom that is taught in English and then one classroom that's taught half the day in English, half the day in Spanish, and that's for each grade, just because we have such a large English language learner population. And I bring all this up just to say that the students at my school, a lot of them are first generation students, many of whom who have just recently come to the US or whose families have just recently come to the US. And many of whom, even the students who have been here for more than one generation, they have a difficult background and they have been faced with things that no child should have to face. And what I'll be talking about a little bit today is hopefully what we're doing, at least in my district, to try and work with the students and to support them as best we can given the circumstances that they're under.
Thank you so much. Thank you, everyone, again, for being here today. I'm so excited that we've assembled this team of superpowers here to talk today. So my first question is kind of a general question. So like everyone, feel free to contribute to any questions that I ask. My first one, to kind of get the ball rolling, is, so what does a trauma-informed approach to education mean? What are the key elements of this trauma-informed environment? What does this look like in schools? If you could speak to that.
We were about to do rock, paper, scissors. Well, one of the first things is really to start understanding, and so many times we abdicate the immense amount of resources and power that each and every one of us hold. And so we talk about something as simple as one of the key elements is to be relationship based, and that matters. But what does that look like other than just saying? That's a word that we throw around a lot, and sometimes we forget the words like relationship, love, and all that gets just get really diluted. One of the first things is, as you uncover the science of trauma, you recognize that individuals may not even know that they operate in their default mechanism in the fight, flight, freeze mechanism, the amygdala brain. And so you start teaching the elements and the science of it with your staff. And one of the very first things that people are repeating now, because I say so many times, is under no circumstances are we suggesting that when you become trauma informed that we need to be passive, permissive, or enabling. That's never the case, but it's in the how. The science clearly shows that right now your brains are assessing what I'm saying, and is it matching to my belief, and is it congruent? Basically, all that to say, do I really believe in what I'm saying? And that's what you're doing right now as you assess all of us that are speaking. That's incredible power. Why? Because as you educate individuals in this, we have to press upon how we consistently show up every day matters. If you're not in a decent state right now, maybe you had a rough morning, maybe just things are pulling at you, maybe life is hard. Another human has the power by having a regulated nervous system within 8 to 10 minutes to change your state without you even knowing. And so you could be in a specific state, and because someone is calm, focused, and is viewing you never as less than now, but with the eyes of the potential you can be, that subconsciously has an effect on you. And so how we communicate and what we say, we're always creating culture. And what we say and how we say it, we're always sending signals. I like to say to staff as I've been going through this journey, training our buildings in Bethlehem, and that is, we have the opportunity, we have the power to be each other's medicine or poison, depending on how we look at each other, treat each other. And it starts that basic. And once you uncover the science about that, then we can start unpacking it. Okay, how can we start putting systems and structures? Because you can have systems and structures all you want, but in our daily interactions, and are we assessing that, and are we being honest about how we talk to each other, how we treat each other? How is that going on? Give you a quick example. It would be as if when my kids were growing up, we would have a Sunday after church family meeting. How we doing? What's going on? What's new? How you feeling? What's ahead? As a father, if I ran a phenomenal family meeting on Sundays, and I did that for an hour, but then Monday through Saturday, I was negative or very neutral, indifferent, and absent, how is that family meeting making a difference? So I allude that to simply that systems and structures we'll get to are important, but really having people to understand that if I consistently show up in a negative fashion, I minimize and I diminish hope in you. And I may say in about 5 or 6 seconds, I love you, or I care about you, or you're important to me, Mr. or Mrs. Staff member, student, or family. But really my state of mind is betraying what I just said. So really having folks to understand, as we throw that term around, your why. Why are you doing what you're doing? And do you really believe that everyone can be a leader? Do you really believe that everyone has genius? Do you really believe that change starts with you? And really emphasizing that.
From a school perspective, in terms of how we worked with our staff, so we did about 2.5 years of professional development with the staff at Liberty High School. And the approach to it was really starting with them understanding the philosophical standpoint of this, right? Which is that being trauma-informed is a way of thinking. Yes, there's actions. Yes, there's systems. Yeah, there's processes. But it's really about the way you think about behavior. And so it's an understanding that is when we, it sounds simplistic, but is the most difficult component of being trauma informed, is to understand that the behavior you see is not about you, right? So we talk about that from a teacher's perspective, that they're in class teaching and they witness something happen in the classroom and the student is dysregulated. And right away, the feeling is I need to control that scenario and ultimately control that person, right? Is what kind of triggers in that teacher's mind. But they have to have the perspective that the behavior I'm seeing is not about me. And so if I do that, I can stay regulated, as Nick talked about, and I can think clearly about how to address it. But the moment that I think that that is me and that is the result of me, I'm now part of the problem, and now I can't address it in a way that's going to be effective, right? So it is, in layman's sense, it is just a way of thinking about the behaviors that we witness.
I'll make a few comments on maybe the more micro approach or things that we look at when we're talking about a trauma-informed. So the National Education Association has done some work on this over the years, and they've identified some key components or elements to working with children. And the first is safety. So do they feel safe? I think that's the first thing that we all approach as educators when we're working with students who are struggling with trauma. And the second is choice, and that's really kind of at the crux of the work that the Center for Humanistic Change does. Are we empowering these young people to make good, informed, healthy decisions in the light of their trauma? Collaboration, I think we've all learned as we grow, you know, the old saying, no one is an island, that it is okay to work with and among other people in working through your trauma. Trustworthiness, I think we find that students who are dealing with trauma do find it difficult to trust others, particularly adults. And finally, empowerment. So empowering these young people to make these good informed decisions through trust, through collaboration, through healthy relationships, so that they can perhaps divert from that pipeline.
Thank you. So I know that you mentioned that sometimes they have trouble trusting adults, and there's other kinds of consequences from their traumatic experiences. So Ezra, I'm wondering if you could kind of speak to what trauma looks like in students. What are the signs that teachers and staff should be trained to recognize? How does it differ between students of different backgrounds and experiences?
Yeah, that's a really good question. I think that with trauma, so one of the key terms we use that I believe was shared in the symposium notes was the term ACEs, or adverse childhood experiences. So there are typically like 10 specific experiences that they measure to determine how many experiences or adverse childhood experiences a person has faced that can lead to then risk and pain and distress in a person's adult life if they've experienced these things as children. And kind of, if we were to group those things into 3 separate categories, really it's if a child has experienced abuse, and that could be physical, emotional, or sexual abuse, neglect or loss. So that could include loss of a parent through death or even just through abandonment, neglect in terms of needs or in terms of emotional needs. And then there's also circumstantial exposure. So whether a student has been exposed to a certain level of violence in the home, or a certain level of mental health concerns from adults in their life, or through drug abuse or substance abuse, or through parents who just simply cannot care for their child. And some of these things can seem preventable, and some of them are just unpreventable. And regardless of the level of preventability, these things occur, and it's unfortunately, it can then really impact the student. And sometimes there really is no way to quote unquote prevent the trauma, but what we can do is we can look for the signs. And at the schools, we can't always stop everything from occurring, but we can do our best to keep the child safe at school. In terms of the types of challenges, I would group them. I think Nicholas said something about the fight, flight, freeze. And that's exactly how I tend to group these behaviors as well, and how I think we can kind of separate them out into the ways that children will present as a student who is struggling. And so the fight, or like these are kind of called externalizing behaviors. They might be really easily angry. They could be showing a lot of restlessness or difficulty sitting still. They might be wandering the halls. There's also a lot of, sometimes they call it defiance or acting out. So they might just not comply with adult requests. That these are all considered kind of the fight behaviors. We have the flight behaviors would be more avoidance. So a student might be skipping class or skipping school altogether. That's where the truancy issues tend to come in, or the chronic absenteeism. They might be going to a nurse or a guidance counselor excessively, so they might be asking to leave the classroom to just go to the nurse. And sometimes it's because they have a somatic symptom, so there's a physical response to the level of anxiety and mood destabilization that they're experiencing. And sometimes they really are just using it as a way to not be in that classroom. And sometimes it's both. They also might just be missing assignments, not turning in their homework, or turning it in really late, or just not being present in class, kind of spacing out. The last piece would be the freeze, or the internalizing. So that might look like crying, or sort of shutting down. So they might not be very responsive in class or outside of class. They may be isolated from their friends, or they may just not have any friends. We can also see sometimes self-harm is something that some students with a trauma background might engage in. And these are all behaviors that we would call acting in. So behaviors where they're kind of internalizing the pain and trauma that they're facing. And regardless of how they're showing these behaviors, we have to treat every student with respect, and knowing that there's no such thing as a problem child, but there are things that children have problems. There are problem behaviors that a child can experience. And it's really important to separate that from, I think there's a really common mentality of, oh, that kid is problematic, or that kid, that's a problem kid. And so part of a trauma-informed approach is understanding that there are no problem kids. There are kids with problems, and that we can help them with those problems with problem-solving techniques. And by experiencing with them, just being calm and patient, and being ourselves regulated and understanding. And like everyone was saying, that then helps the students to be more regulated and to be more trusting of us, because truly it is just, if one adult can be that person for the child, that can make all the difference. Studies have shown that having a trusted adult in the student's life can be a protective factor. And the statistic that I wanted to share that just really surprises me whenever I reread it, but I think it's really important to know. According to the CDC, there's 64% of adults in the US report experiencing at least one adverse childhood experience, one ACE, and 1 in 6 experience 4 or more by the time they're 18. So just thinking about the fact that sometimes we see trauma with a capital T, and like this is something that's not very common or doesn't really occur, or we're only thinking of the capital T trauma like war or some sort of abduction, but there are so many ways that we can be impacted by the circumstances around us. And oftentimes students are struggling with a lot more baggage than we realize.
Thank you so much. I really like your quote, there are no problem kids, just kids with problems. I think that's kind of the mentality that it really sums up that we're trying to get here. So why is this approach so important? I know I shared some statistics in the beginning, but why is this trauma-informed approach so important? What are the consequences of not having an approach like this? What are the positive consequences that you have seen, in your careers of implementing an approach like this?
So first, I want to kind of quickly comment on that, the last statement, right?
Sure.
Is when you think about this from a philosophical standpoint, approaching it from the place of whether it's a student, whether you're a police officer, whatever it may be. If you're thinking about it in terms of the question, what is wrong with you versus what happened to you, right? Those are two very different approaches to assessing how to help or support the person you're working with. And so that in and of itself, I think changes things quite a bit. Specific to your next question, I can kind of talk about it from the perspective of what happened at Liberty. So I started at Liberty in 2012, and by around 2015, 2016, we started to see that no matter what we did to try to help our students, we weren't seeing the progress that we knew our kids could produce. And that was academically, socially, behaviorally, the whole thing. And so that was the point in which we started to really dive into this world of trauma. If you recall, around 2015, 2016, nobody was talking about trauma. That word was not a common word. If the word trauma came up, it usually meant emergency room, right? Physical, those kinds of medical situations. But it just started to blossom, and a lot of that was due to Nadine Burke-Harris and her interpretation of the Kaiser Permanente study that happened much prior. But that was the point in which we discovered her talk, and on YouTube, thankful for YouTube, and really opened our eyes as to why we weren't seeing the progress that we were doing. We were putting all of the efforts in to all of these different components of our students' lives and not dealing with the trauma that they were facing. And so as a school, we decided we needed to do something about that. And so we began pooling resources. We began putting together a committee of all the members of our school, whether it be secretaries, assistant principals, teachers, you name it, and started to really assess what was happening in the brains, bodies, and lives of our kids. And that process truly opened our eyes. And so it allowed me to then go to our superintendent and he to our school board to say, hey, we have to start to do some things differently because what we're doing is not meeting the need. And we were very fortunate that both our school board and our superintendent, Dr. Roy, were very, very supportive of the process and dove in and allowed us at Liberty to really kind of be the starting point for this work. And as we dove in and started to see some progress, it then opened up that process to the rest of the district. And so really at this point, Bethlehem in whole is really a trauma-informed district and one that really works at providing these services across all 22 schools. But the reality is that if we didn't do that work, if we didn't train our teachers, if we didn't put services in place, if we didn't allow the community to see that it's okay to ask for help, it's okay to seek support, it's a part of who we are as human beings. If we didn't normalize that, none of the progress that we've made would have happened. So what it does is doing this work depending on the kid, either allows them to just survive and get through what they're dealing with, and then others allows to really flourish and take advantage of those supports so that they can access true learning, right? We know that learning only happens at self-actualization. So you have to get all those other blocks underneath it out of the way in order for that to happen. And so not just being trauma-informed, but providing a holistic mental health program and process gets that stuff out of the way so that students can be successful.
Thanks. All right. So thinking about how we're all saying that this trauma-informed approach has all these, benefits to students, giving them support to help them actually learn in the classrooms. If they're going through this fight, flight, freeze response, learning is such a challenge, right? And it's kind of like put to the back burner when they're trying to survive every day. So how do we measure the effectiveness of this approach? What work has been done? How do we know that this stuff is effective for students?
Well, one of the first ways is just traditionally speaking, when you earmark and you know which students are receiving what tier services, you start off with, as they're receiving these support services, what change has happened in their attendance, in their academics, behaviorally. But that's not where we begin there, but we don't stop there. Then you need someone who is able to manage, supervise, and really, at the very least, a weekly rhythm, be able to monitor the contract, the covenant, so to speak, that agencies have committed to doing. So you need someone to man the bank, the store, for lack of a better term. So for an example, if you are committing to clinically that in our organization, our therapists can have a caseload of 35 kids, we're going to use 35 slots. That doesn't mean we fill them up by October. We're very prudent and we use wise judgment, but we also maximize the services that individuals have partnered with us. Now, here's where you really can dig down and see the effectiveness of it, is the students. You talk to them and you ask them. And so we ran an end of the year survey, May of 2022. Since then, we do a middle of the year and end of the year survey, what we call perception data, street level data. What are the young people ages 14 to 18 saying? Some of them coming from heavy lifts, difficult circumstances and challenges. What is this specific, perhaps therapy or mentoring or group service, or perhaps, as we call, we'll explain later, peace room service, being taught executive functioning skills and regulation skills? What are they saying to us? I don't have all these memorized, but right now, in January, we've had both high schools in Bethlehem report out to us. Just want to mention a couple because they're very powerful. So here's the perception data to know, are they making a difference? Is this making a difference? 83% of our students are reporting that they are better students. 60% of our students are saying they're more connected to their school. These are kids that are going through some heavy stuff. And if my place of pain is not connected to my school, chances are, with some of the tragic stories we see through the news with the horrors that are happening, chances are I'm not going to do that in a place that's not a source of my pain. Nearly 90% of the students see their life in a more positive way. Here's my favorite one. I always go after this one. I am more hopeful about my future. 83.16% of students in the high school are reporting that. If we can elevate your hope levels, we can elevate your resiliency. If you're more resilient, you're healthier. If you're all those three things, then your attendance most likely will improve, your grades will improve, your high school graduation rates will improve, and most likely your post-secondary college getting in rates are most likely going to elevate, and that's powerful. Now we talk about the power of one person in someone's life. When you study the science of trauma, that separates someone who's going through a difficult time versus toxic stress. So having one person, a transition person in your life that has your back, you can confide to, you can share in a judgment-free zone, that they're there to encourage you and also push you. There's that trust factor, right? Exponentially changes someone from being in a traumatized state, from being in a toxic stress state or a stress state. And you may not be able to, that transition person may not be able to change the circumstance or condition of that human's life, but just being there for them exponentially changes a lot. And this is what they're telling us. The person I meet with cares about me even when I mess up. Nearly 94% of the kids are reporting that. Here's another one. Think about someone who comes from a traumatized background and how deep perhaps it's difficult to trust someone else. 92.63% of students, this is middle of the year data, by the way, 92.63% of our students report, the person I meet with, I trust. 92%. So what happens after this perception data is I gather all the providers together, whether it's their supervisor or them, and I say to them, you see this? There's 5 choices kids can make. They strongly agree, they're neutral, disagree, strongly disagree. Whoever's on the disagree, strongly disagree, or neutral part, we need to move the lever. Neutral to me is like if I put you in a room with a goldfish and you just stared at the goldfish all day. We can't be neutral in this work, right? The opposite of love isn't hate. As Eli Wiesel said, it's indifference. We can't be indifferent. Let's get after it. 2 quick testimonials that excite me as well. Well, by the way, we also not only track the referrals, we also track how long are kids, what's the average length of service? We don't want someone in service indefinitely, right? There has to be some type of measurement with that because we want to get other kids to. We won't rush it. And some kids have significant scenarios, but what's our average length of service? Because Andrew's next to me right now, I'd like to report from his organization. We not only track the length of service, but the percent of successful discharges. 95% of kids that receive your services report successful discharges. They went through the program, they got the skills and strategies that they needed, and we allow the slots for someone else. 2 quick testimonials, if I can. A student that was working through anxiety and depression and challenging home dynamics. The Wellness Center has shown me the power of asking for help. It's helped me build trust and open up and has given me a space to express my stressors and let them pass. Everyone is nice, and it's made me realize I'm not alone. Powerful. One more testimonial after a student that lost a parent. I like the Wellness Center because it's helped me with my grief this year and personal struggles. The groups and adults have really helped me. And I can't resist one more. Students that are battling with vaping and addiction to THC. I love the Wellness Center because it helps me with my mental health and they help me overcome my addiction to THC and nicotine. It makes me have a more positive attitude and not procrastinate with my schoolwork. I have not smoked in 4 weeks. I had orientation for my new job last week and I start next Monday. And so last but not least, we also take data on our peace room. There's a whole system we set up with that it does not become an escape mechanism. And we have our grad level students from a local university who man that area. And so we have a system, so you can't just willy-nilly go down there. We work it through our SAP team. And when you are eligible to receive that service, we teach young people how to utilize a break, how to take a break, how to not go to the next level and react to something or get myself involved in a situation. I can utilize an area where I can just be left alone or someone can work with me and talk to me with regulation skills. And we have that down to science. Unless you're dealing with some psychotic or some deep-rooted mental illness, in about 8 to 12 minutes, the average human is regulated. So we have it like clockwork. After 8 to 12 minutes, the student should be ready to go back to class. Over 96% of our students report after that 8 to 12 minute break, they're going back to class. If they're reporting my anxiety, my anger, my whatnot on a scale of 1 to 5, 96% are reporting I showed up like a 4 and I'm down 2 notches. So we just stole 8 to 12 minutes to be able to have somebody be a better and a healthier human, to be able to learn strategies and skills, how to regulate their nervous system, which I believe is the best hack that you can have currently. And now I'm going back into class because ultimately, what are we there for? To teach you academic content and skills. So it's very important that there is some rigor to what we do and we take data and it's supportive. We don't just feel good about it.
Yes, thank you so much. Of course, LVJI is all about data-driven, evidence-based practices and research. So thank you so much for sharing all of that information about how you're verifying that you're getting the outcomes that you're striving for. And obviously those statistics are very high. So clearly you are doing a wonderful job. I want to ask one final question before I open it up to audience questions. Particularly, Andrew, if you could share some examples of some of these programs that have successfully, reduced the school to prison pipeline through these trauma-informed approaches. What have you
Yes,
experienced?
absolutely. I'll refer to 2 programs. Before I refer to those 2 programs, I encourage, you're hearing my colleagues and I talk a lot, saying the word resilience a lot today. And I think for a lot of us, we are recognizing that some of these young people have to build some more resilience. And I encourage you to read the work of Dr. Kenneth Ginsberg, who is a pediatrician out of CHOP and really the world's leading expert on resilience. So I encourage you to do that. But we do use As Nick referred to, in the Bethlehem Area School District, we are working with a program called SPARK, which is out of an organization in Tampa, Florida. And I always have to remember what acronyms stand for. SPARK stands for Speaking to the Potential, Ability, and Resilience Inside Every Kid. And it is an evidence-based program which works on some of those earlier pillars that I talked about, but it's really skills-based in terms of helping these young people develop some skills and to be able to begin inwardly first before they can begin some of that more outward work. Then they move to a small group setting, so a safe space, but in a pretty controlled environment. And then the next level would be functioning in a healthier way in schools and communities. And what I noticed when I was a principal is I had two types of kids that would come in to see me. One kid would come in and say, hey, Mr. D'Angelo, I messed up today. I made a bad decision today. I did something I shouldn't have done today. Then I had other kids who would come in and say, Mr. D'Angelo, I was bad today. And I found that the kids who referred to themselves as bad were more often than not children who were dealing with trauma. So as opposed to realizing that the world existed beyond the teenage silly mistake they made that day, that they tended to refer to themselves as bad. And I think these evidence-based programs try to reframe this approach to trauma-informed education and having them really reframe their brain in a way that they think about it. The other program, which is an evidence-based program, which we are currently working on, a shared grant with the Lehigh Valley Office of Children and Youth, the Salvation Army, Lehigh County Juvenile Justice, and Lehigh County Probation, is a program out of the University of Utah by a Dr. Carol Comfer, and it's called Strengthening Families. And we're engaged in two arms of that program right now in the Lehigh Valley. One is Strong African American Families, and one is Familias Fuertes. And they are working specifically with diversionary tactics, and it's a very holistic approach to dealing with trauma in these communities, working with the parents, working with the children, and presenting them with really alternative ways of framing their lives and the decisions that they make. And we have found great success in both of these evidence-based programs.
Thank you so much. All right, I want to make sure that we have enough time to ask some audience questions. So I'll open it up, and Christine is going to have a microphone, and Megan. They'll have microphones that they can pass around. So if you have any questions, raise your hand. We'll get a mic to you.
With regard to adverse childhood experiences and trauma-informed practice approaches, do you include the discipline committee or system that you have in your educational programs? Because a lot of the research shows that juvenile justice system, as well as school discipline systems, contribute to risk factors for students who might not be able to succeed once they've experienced those encounters.
I'll jump in there just real quick, very quickly. As a principal, the drum that I banged every single day in dealing with frustrated teachers was that justice needs to be restorative and not punitive. We are way beyond the days of detention working and sitting and staring into space for an hour. And, what are ways that we could make children respond in a restorative way, to make them whole, to recognize that there are different ways of approaching, different ways of making decisions, and how they can learn from the way that we are reacting to the decisions that they've made, as opposed to a punishment-based discipline system. It doesn't work, it's never worked, and it never will work.
I would say yes, twofold. One, the people that create the referrals that lead to suspensions or discipline are generally teachers, right? That's generally where the majority of referrals come from. So if we do our due diligence in educating teachers about trauma and they understand where the behavior is coming from, they're therefore more empathetic. They're more understanding, and therefore write students up less. And as a result, right, less referrals come through, therefore your numbers decrease there. The individuals who then adjudicate that discipline, right, are your assistant principals. And so for the most part. And so those individuals, if they are trauma informed, then they recognize where the behavior comes from. And again, it doesn't always excuse behavior, but it helps you understand it better. And so as a result, the way you process that discipline changes and alters. And so what we saw at Liberty was both a decrease in the frequency, but more significantly in the duration of suspensions and disciplinary results.
Hi, I just wondered, to be a trauma-informed school, is there a curriculum or a platform or a guide that school systems can use that can help them learn how to become a program that's trauma-informed?
I can answer that. We do have such a program at NCC. So if you'd like to know more about it, please feel free to get in touch with us. But perhaps there's other answers to that as well.
Yeah, the book that we utilized was called it was Trauma Informed Classroom, I believe was the name of it. I don't know the name of the author. It was a white book. But that was really what we did was when we formed our committee was each pair in our committee was responsible for breaking down a chapter in that book. And so we would meet as a committee, break down the chapter, talk through it. And then the result of that process, which took us, probably a good half a year, we then utilized that process to determine what was the training we were going to put in place. But we as a building created that training. This was starting in 2016, 2017. There really wasn't much of anything. There's probably a whole lot now, but when we did it, we created it, except for that textbook.
And if I can just add to what Harrison just mentioned, he was spot on, is that we also share with our staff the video, how childhood trauma affects health across a lifetime, about 15-minute video, TED Talk with Nadine Burke-Harris. You also want to hook people in there because sometimes you get them off the bench by really learning about what's in it for me. And you learn really quickly that not only what has happened to you, but if you live in a specific prolonged state, a prolonged mindset, if your default is a specific mindset, right? If you don't have some daily renewal strategies and practices, right? If you don't see the bigger picture as to why you're doing what you're doing, and you're in that negative emotional state, maybe not a negative person, but internally there's something else going on, that really over a long period of time impacts you from a health standpoint. So that's an example of, okay, this is what's in it, because even though it's for others, it's also going to benefit you and those that you claim that are most important in your life. The second piece is we also saw the video resiliency and also paper tigers. And so these were the things as we went through the journey, as Harrison said, we created it. These are some things that we were really shifting mindsets before we started putting in our robust 3-tier system and structure.
I know it sounds silly, bizarre, but have some of these programs been put in place for middle schools? For middle schools as well, like for the younger kids, like 12 or 13-year-olds, have some of these trauma programs been put in place for middle schools as well, like how they are in like high school and college?
It's the Spark program to which I referred is a K-12 program. And as Harrison referred, my first year as a principal was 2015. And it was the first time I ever got a notice about a professional development on the trauma-informed classroom. But it was specifically targeted toward elementary school students at the time. So many of these programs, I think, are successful in K through 12.
I will say that, so I currently work in a K through 8 school, and we're doing work with the trauma-informed approach, as is the district-wide. I will say though that a lot of what I studied in graduate school was actually just the fact that there's a real big gap between evidence-based interventions for high school and elementary. And then there's kind of this wide space for middle school. So there's definitely less evidence available for the support for middle school students. Not that we can't use it, but that a lot of the programs are built for a younger audience or an older audience. So this is an area that I personally hope to see more progress in, because middle school students really, really benefit from the support. There's just not a lot of programs that are geared specifically towards those students that are evidence-based programs at this time.
I just took a quick look. I think I looked on Amazon. There's a bunch of books out on it. I believe the author, the one we use, was Schroeder, I believe, like Schehoer, something like that. Schroeder, something similar to that.
Can I mention one last point about the younger kids? Yes, we have different services and programs for the middle school kids as well. As Andrew was mentioning, we also have CHC in Bethlehem in the middle school level. We also have Valley Youth House providing cognitive behavioral therapy in groups for kids. And the first time ever, we're servicing all our kindergarten classrooms. 5 and 6-year-olds, we're teaching them that young how to be calmer, how to be kind, how to work through different regulation strategies. And for the first time ever, we're also training all our 5th grade classrooms amongst the 16 elementary schools to teach them regulation strategies and how to learn a life transition of going, think about when you were a young person, a kid going from 5th to 6th grade. So we've partnered with an agency to go after all our 16 elementary schools to teach them, right, how to regulate your nervous system as young as 5 or 6, because ultimately your IQ can be off the charts. But if you can't do that, your functional IQ is not as solid as what you're born with. So we start that at a young age, to answer your question.
There's also several, they would be considered universal, like tier 1 supports. So there are several curriculums out there that benefit students in middle school specifically. I know my school uses Second Step as a tier 1 support. There's a couple different universal screeners that have also been found to be useful for middle school students specifically, although a lot of them start at age 6 and go up to 18. So again, nothing that was specifically built for middle school, but there are things that are definitely working for middle school students out there.
My question has to do with the continuum of care. I'm looking specifically from the more criminal justice side of things. My question to you guys as mental health professionals is, do you see a similar concept reflected in the criminal justice system? And if not, what obstacles do you guys see as people working in mental health to getting there?
I think that question might be really beneficial for our next panel. What's the next one? It's the one in mental health co-responders. Yes, that's the next panel, right at 11:15. So if you can hold that question for just a little bit longer, ask it at the next one.
Victoria, is the question about the connection between K-12 schools and the impact on prisons, or like what piece, what's the connection that you're trying to ask about?
My question is just, I've been educated in criminal justice, and so I was just curious to see what the mental health side of things would look like, particularly, involving the experience that you guys have in the school systems because of the school to prison pipeline and trying to reduce that.
I mean, I think as kind of stated, you'll probably get more information in the next panel. But the one thing I will say is, I made this statement there was an event that was being run before I was even involved with this great organization here. It was actually here at Northampton, where you guys did an event, LVJI. And one of the things I got up and spoke about is to say that we absolutely have to start to take mental health seriously in this country. Although we do better now than we did 10 years ago, it's still a joke in the grand scheme of things. And so specifically, the way in which we dedicate services to young people in this country. So there's been times where we have had students who have left us for some type of acute mental health situation. They're seen at one of the local hospitals, released sometimes within hours, and back up the next day walk into the school. When the family then contacts those organizations to say, hey, when can we set up services to get ongoing support? There have been times where they're told there's 6-month wait. 6 months, right? The kid just was in an acute situation, and now you're saying there's a 6-month wait. And so and the reason I bring that up is because until we start to take mental health seriously in this country, specifically at the K-12 level, our prison issue is not going away. In fact, it's going to continue to grow exponentially. We have to decide that we're going to do something about this problem. I mean, the statement that Joe made earlier about, right, where is mental health counseling happening when you look across counties across the country, it's not a mistake. It's because we're not doing our due diligence early on when these issues are beginning so that we can try to intervene and provide supports. So as a country, until we take that seriously, the prison problem is not going anywhere.
Just following up on your remarks, Dr. Bailey, to the last question. I'd like to focus on what's happening here in the Lehigh Valley. You know, certainly the Bethlehem school system has recognized this as a very important issue to in the education of our children, and is doing something profound to correct what we see as a failing in education more broadly. But there are economic concerns about how to provide these services, and I'd like to, understand better the challenges that you've had in financing your program at Liberty High School and throughout Bethlehem, and whether or not within the broader Lehigh Valley we have a real initiative to bring this kind of program into other schools or all schools within the valley.
Well, I mean, I would say that obviously there are considerable resource concerns around mental health. And that is, one, just schools in general and the way in which we fund schools across the Commonwealth, and the lack of funding. Just look at the fair funding formula, and those concerns right there creates a huge gap. But again, we don't take it seriously as not just a community or a country, a Commonwealth, but a country. And so we don't focus the dollars that need to be focused on mental health when we need to do it. When you look at the services that are available to people just in communities, those services compared to what they at one point were don't exist. And so where are families going, right? Who do they turn to? Well, the vast majority of parents turn to their schools because that's the only game in town in many respects. And so as schools, now what do? Right? Where do we garner supports? Well, your guidance, your school counselors are overrun with, many of them have significant caseloads, and they are, if you know anything about school counseling, they are a conglomerate of 1,000 different things that we put on them to handle in our schools. And so they can't do much more than triage, just to be honest. I mean, that's just what happens. So where's the ongoing support coming from, right? And so as a building principal, I would be knocking on my superintendent's door, right? That we got to do something. We got to do something. Now he's got to deal with thinking about right now, where's that money going to come from? Tax base, right? And where, I mean, are there grants available, right? And so now you're fighting the fight of how do I seek out dollars outside of our normal operating budget to try to garner these supports. It is a very, very difficult task. You know, and honestly, it's not getting easier. It's only getting more difficult as needs arise in a lot of different areas. So we're not federally or statewide putting the dollars into our school systems that would allow us to tackle this the way we need to. It's just not happening. I was fortunate enough I went and testified in Harrisburg at the Education Committee through the Pennsylvania Principals Association. And these are, you know, I don't know, it was 15 legislators sitting on the board. And a number of us came there to testify about mental health in the Commonwealth. These are all good people. These are people who are there because they want to support government in our Commonwealth. They want to help kids. But the reality is they didn't know anything about what we were talking about. They had no clue how bad it was. Zero. So like, we're in a crisis. And the people who hold the purse strings to make those decisions don't have the information they need to have to be able to make the right decisions to fund it. Right? So depending on that process, I can tell you now, it's not working, right? And so now it falls on the taxpayer to try to figure that out in conjunction with school boards to say, right, so how do we in our schools provide this service because we're not getting those services from the state or the federal government. It's just not happening, right? So many of us try to partner with hospitals, St. Luke's, Lehigh Valley Health Network. We try to partner with our nonprofits in our communities, right? They can't work for free, right? That funding has to come from somewhere so that they can pay their people to do the work that they do. And Bethlehem, we have been so fortunate in Bethlehem that we have so many partners that are willing to step up and work with us and be a part of what we were doing. Very, very fortunate. But again, if Pinebrook is pouring all their time into us, well, that means they're not pouring it into Allentown or Nazareth or right. So that's the problem, right? Is that there's not enough funding to make sure that there's enough supports in the community to do the work, and for school districts to pay for that. It's not a good situation.
And even to look at the unfortunate prioritization, the opioid crisis in the Lehigh Valley is certainly everywhere is certainly a catalyst into the prison pipeline, but the opioid prevention settlement money cannot be used for prevention. It can only be used for treatment. So instead of there's that pool of money which would be so effectively used to try and prevent a continued opioid crisis, but it can't be used to prevent, it can only be used to treat. So even the money that is available is unfortunately not prioritized in a very smart way.
And if I could just add, I'm not suggesting this would answer your question, but we're riding on 5 to 7 years of just pure passion, what we created. You know, Harrison and I are spokespeople right now, but there was also a team involved that's not here. Of course, the support from central office. And I would tell you that building internal capacity of your people, services and supports are critical. They're necessary because some individuals need more and they need tier 2 and 3 services, but building internal capacity of just really educating and training your staff on a different way of being. This is inside out work. If someone's like, yeah, I'm on board for trauma-informed work and this and that, but they're unwilling to change, this is inside out work. This will change you, but for the better, to be a better human, to be a better human for others, to multiply better humans. And the second piece is really being forward thinking. I know I keep alluding to the place that I work, but Dr. Roy's in attendance here and he will be on a panel later, but really really having that mindset and having a forward-thinking board and forward-thinking budget priorities. If we all look at our personal budgets, it tells us what our values are, right? And so even with all this perception data I quickly read to you, we've had that going since 2022. Just this past summer, we put all our tier 3 therapists in the operating budget. And so now we don't have to think about every year, oh, will this grant come through and all that? But that's just a small sliver and does not come even close to answering your question. The last part is just having awesome relationships with Community Center for Humanistic Change and other providers and agencies. And they're, like Harrison said, they're trying to find their grants and services, but we are really open to allow our place to be fertile ground, just this experiment and try different things. But a small piece of that is, what is the mindset? What is the philosophy? And what are we willing to spend on from a budget standpoint? But by no means or any stretch, Harrison's absolutely correct. And what Andrew said, I mean, the state priorities, the federal priorities, are going to have to assist as well.
Right. So thank you so much, Harrison, Andrew, Nicholas, and Ezra, for joining us today on this panel. If you have any other questions in the audience, I'm sure they'll stick around for a couple minutes and they'll chat with you. But yes, thank you so much. It's been so enlightening. Thank you.